So what exactly is a drug interaction? Simply put, it's when one substance, like another medication, a supplement, or even certain foods, affects how a drug works in your body. This can make the drug less effective, more powerful, or cause unexpected side effects. With amlodipine, understanding these potential interactions is key to staying safe and ensuring your treatment is working as it should. Let's start by looking at some common prescription medications. One major group to be aware of are certain types of antifungal and antibiotic drugs. For example, medications like ketoconazole, itraconazole, or clarithromycin can slow down how your body processes amlodipine. This means more of the drug stays in your system for longer, which could increase its effects and lead to side effects like dizziness, swelling in your ankles, or an excessive drop in blood pressure. If your doctor needs to prescribe one of these, they might adjust your amlodipine dose or monitor you more closely. It's a delicate balancing act that your doctor is trained to manage. Another category includes certain medications used to treat HIV, known as protease inhibitors, such as ritonavir. Much like the antifungals we just discussed, these can also increase the levels of amlodipine in your bloodstream. Again, this raises the risk of side effects. It's crucial that all your doctors, including any specialists you see, are aware of every medication you're taking to prevent these kinds of interactions. Communication is absolutely vital for your safety. Now let's talk about a very popular medication for high cholesterol, simvastatin. Here's an interesting one. Taking amlodipine with high doses of simvastatin can increase the risk of muscle problems, a rare but serious side effect of statins. Because of this, medical guidelines often recommend limiting the dose of simvastatin if you are also taking amlodipine. Your doctor will know the appropriate dosage to keep you safe while managing both your blood pressure and cholesterol effectively. Next up, some anti-seizure medications. Drugs like carbamazepine, phenytoin, and phenobarbital can have the opposite effect. They can speed up the breakdown of amlodipine in your body, making it less effective. If you're taking one of these, your blood pressure might not be as well controlled. Your doctor might need to increase your amlodipine dose or consider a different blood pressure medication altogether to make sure your treatment remains effective. Immunosuppressants are another important group. These are medications often used after an organ transplant or for certain autoimmune diseases. Drugs like cyclosporine or tacrolimus can interact with amlodipine. The interaction can go both ways, potentially increasing the levels of either drug in your system. This requires very careful monitoring by your healthcare team, often involving regular blood tests to ensure the drug levels are within a safe and effective range. It's not just prescription drugs we need to think about. Over-the-counter medications and supplements can also play a role. A big one is St. John's wort, a popular herbal supplement used for mood support. Similar to some anti-seizure drugs, St. John's wort can speed up how your body processes amlodipine, potentially making it less effective at controlling your blood pressure. This is a great example of why it is so important to tell your doctor about everything you take, even if it's natural. And what about everyday things? Even grapefruit can cause issues. Grapefruit and grapefruit juice can block an enzyme in your intestines that helps break down amlodipine. This can lead to higher levels of the medication in your blood, similar to the effect of some of the prescription drugs we mentioned earlier. This increases your risk of side effects. For some people, the effect might be minor, but for others, it can be significant. To be safe, many doctors advise patients on amlodipine to avoid consuming grapefruit altogether. Another common over-the-counter item to be mindful of are NSAIDs, or nonsteroidal anti-inflammatory drugs. This includes things like ibuprofen and naproxen. While they don't directly interact with amlodipine's metabolism, they can sometimes raise blood pressure by causing the body to retain sodium and water. If you're taking amlodipine to lower your blood pressure, regularly using NSAIDs might counteract some of its benefits. For occasional pain relief, it's usually not a problem. But if you need to take them frequently, it's a conversation worth having with your doctor. So, what's the big takeaway from all this? Communication and vigilance. First, always maintain an up-to-date list of all your medications, including prescriptions, over-the-counter drugs, vitamins, and herbal supplements. Share this list with your doctor and your pharmacist every time you have an appointment or pick up a new prescription. Your pharmacist is an excellent, often underutilized, resource for checking drug interactions. Second, when you're prescribed a new medication, specifically ask your doctor or pharmacist, will this interact with my amlodipine? Being your own advocate is a powerful tool for your health. Third, pay attention to your body. If you start a new medication or supplement and notice new or worsening side effects like increased dizziness, flushing, a racing heart, or more swelling than usual, contact your doctor's office right away. Don't just assume it's something you have to live with. It could be a sign of an interaction. And finally, please do not make any changes on your own. Don't stop taking your amlodipine or any other prescribed medication because you're worried about an interaction. The risks of uncontrolled high blood pressure are very serious, including heart attack and stroke. Always talk to your healthcare provider first. They can assess the situation, adjust dosages, or switch medications safely if needed. Your health and safety are their top priority. We've covered a lot today, and I hope this information helps you feel more prepared and confident in managing your health. Knowledge is power, and understanding how your medications work together is a critical part of your treatment plan. If you found this video helpful, please give it a thumbs up and consider subscribing for more health content designed to empower you. Share it with anyone you know who might benefit from this information. Thanks for watching, and we'll see you in the next video. Stay safe and be well. This video is for educational purposes only.